Take a slow breath for me right now. If you've recently been told your PSA is 8, 9, or 10, I know exactly what just ran through your mind. You sat in the doctor's office, stomach tight, and before the words were even spoken, your imagination raced through worst-case scenarios. I see it all the time. Men lean forward, hands gripping the chair, eyes searching mine for reassurance. Sometimes they've spent hours online, scrolling through forums and charts. Sometimes they haven't slept for nights. And almost always, the first question is the same. Doctor, does this mean I have prostate cancer? I'm Dr. Jocelyn, and for the past 5 years, I've worked with men navigating urology, prostate health, and anxiety around these numbers. I've watched countless men sit in that same chair, heart racing over a single lab result. And today, I want to talk to you calmly, step by step, about what a PSA of 8, 9, or 10 really means. Here's the first truth. A PSA of 8, 9, or 10 alone does not diagnose cancer. It isn't a verdict. It isn't a signal to panic. It's simply a measurement, a marker of prostate activity. PSA, or prostate-specific antigen, is a protein made by your prostate cells. Normal cells produce it. Abnormal cells produce it. In other words, PSA measures activity, not cancer. So what does an 8, 9, or 10 actually mean? That's what we're going to unpack together. Before we go further, do me a favor. Comment below and tell me where you are watching from. Like this video if you want honest, practical guidance without hype. And subscribe for clear, respectful advice to protect your health and confidence. Let's take a real example. Let's call him Michael. He was 68 when his PSA came back at 9.2. He arrived at my office convinced he had cancer. He and his wife had spent the night reading online survival statistics, worrying about side effects. Tears had been shed, anxiety was high, but when we looked at the full picture, everything shifted. PSA is influenced by many factors: benign prostate enlargement, inflammation or infection, recent ejaculation, and certain medical procedures. Years ago, a PSA over 4 was concerning, and over 10, very concerning. But modern urology looks at context, trends, and individual risk factors. For example, a healthy 75-year-old man with a large prostate may naturally have a PSA near 8. A 48-year-old with the same PSA may require closer evaluation. When Michael's PSA was 9.2, I didn't rush to a biopsy. Instead, I asked, has this been measured before? It had. 5 years ago, it was 5.8. 3 years ago, it was 6.9. Last year, it was 8.4. This year, 9.2. Notice the pattern. Slow, steady increases often indicate benign enlargement. Rapid jumps are more concerning. This is called PSA velocity, the rate of change over time. Numbers in isolation tell only part of the story. Let's dig deeper into what's happening biologically. PSA rises naturally with age because the prostate grows. Larger prostates produce more PSA simply because there's more tissue. We calculate PSA density PSA relative to prostate size to get a clearer picture. Free PSA percentage matters too. Higher percentages are generally reassuring. Lower percentages may prompt further evaluation. Then comes the digital rectal exam. Yes, it's uncomfortable, but invaluable. I check texture, symmetry, and nodules. Smooth enlargement often signals benign prostate enlargement. Hard, irregular areas warrant more concern. We also examine urinary symptoms. Benign enlargement typically presents with weak stream, nighttime urination, and slow emptying. Early prostate cancer, on the other hand, often has no symptoms at all. Other risk factors like family history, ethnicity, overall health, and prior biopsies each layer into the overall risk assessment. For Michael, everything aligned with benign enlargement, smooth prostate, gradual PSA rise, reassuring free PSA, and urinary symptoms consistent with benign enlargement. Suddenly, 9.2 didn't feel like a crisis. It was a signal to evaluate thoughtfully. Today, prostate MRI has revolutionized how we approach PSA in the 8 to 10 range. MRI identifies suspicious lesions for targeted biopsy and provides reassurance when no concerning areas are present. Biopsy is safe but not risk-free. Infection, bleeding, temporary urinary issues, and anxiety are all possible. Active surveillance or watchful waiting often makes sense for low-risk cases. Here are the key takeaways. First, confirm temporary factors: infection, ejaculation, catheter use, vigorous cycling. Sometimes repeating the PSA lowers the value. Second, consider MRI first, as it avoids unnecessary biopsies. Third, if a targeted biopsy is needed, it is precise, less invasive, and reduces detection of insignificant disease. Every step involves shared decision-making. I ask my patients, what matters most to you? Some prioritize certainty. Others prioritize avoiding invasive procedures unless clearly necessary. Waiting for PSA results is stressful. Fear and anxiety are normal, but knowledge reduces fear. Here are practical steps you can take now. Bring previous PSA results to your appointments. Ask about prostate size and PSA density. Discuss MRI before biopsy. And address lifestyle factors, healthy weight, regular exercise, a diet rich in vegetables and healthy fats, and good cardiovascular health. Remember, not all cancers behave the same way. Many are slow-growing and manageable. Treatment is tailored to aggressiveness, age, health, and personal priorities. Michael's case shows the power of context. Understanding his PSA trend transformed panic into clarity. He could take measured steps, stay vigilant, and avoid unnecessary procedures. So, if your PSA is 8, 9, or 10, don't panic. Gather context: trends, age, prostate size, symptoms, and family history. Ask thoughtful questions about PSA velocity, free PSA, MRI, and biopsy risks. Consider lifestyle adjustments for overall health, and partner with a trusted physician for shared decision-making. Here's the bottom line. PSA is a tool, not a sentence. Numbers don't define you. Vigilance, knowledge, and collaboration with your doctor are what matter. You are not defined by one lab result. Many men with PSA in this range live long, healthy lives without aggressive treatment. Small, informed steps restore confidence. Thoughtful evaluation protects dignity, and modern tools allow precision without panic. Comment below, have you recently had a PSA in this range? What questions are still on your mind? Like this video if it helped you feel grounded, subscribe for clear guidance to protect your health and confidence, and share it with someone who may need reassurance. I'm Dr. Jocelyn, and after 5 years in men's health, my final words are simple. Numbers are signals, not sentences. Knowledge, vigilance, and partnership with your doctor make all the difference. Stay informed, stay calm, and stay confident.